This video will examine the drug Rosuvastatin, what it is used for, and wait for it, 8 surprising facts coming up. I'm Dr. John, and this is Think Your Health. Let's get to it. What is Rosuvastatin? Rosuvastatin is a cholesterol-lowering prescription medication. The brand name is Crestor. What is Rosuvastatin used for? This medication is used to lower your bad cholesterol, called LDL, and raise your good cholesterol, called HDL. It can also lower another fat called triglycerides. In this way, Crestor can slow down the plaque buildup in your arteries. This reduces the chance of heart disease and reduces the chance of stroke and heart attacks. How does Rosuvastatin work? Rosuvastatin belongs to a class of medications called HMGs, coenzyme A reductase inhibitors. These are also called statins. This medication blocks an enzyme in your liver which results in a decreased production of cholesterol. It also increases the uptake of cholesterol in your blood and in turn is broken down in your liver. This results in less cholesterol that might be used to build on the walls of arteries. How is Rosuvastatin taken and what is the dosing? Doses for the tablets are 5 milligrams, 10 milligrams, 20 milligrams, and 40 milligrams. Crestor can be taken daily with or without food. Can I drink alcohol with Rosuvastatin? You should limit alcohol intake, about 1 to 2 drinks a day. That would be the equivalent of 5 ounces of wine per drink. Higher doses of alcohol over time can damage your liver. Remember, Crestor to a certain degree is also metabolized in your liver. Can I take this drug if I am pregnant? The FDA does not recommend that you take this drug during pregnancy. The risks outweigh the benefits, as this medication can cause birth defects. What are common side effects for Rosuvastatin? All drugs may cause side effects. The goal of this channel is to educate you if you're on a drug, how it works, and what you might expect in terms of common side effects. There will always be some people who have no or only mild side effects. If you do have side effects, call your doctor as soon as possible. Do not suddenly stop any medication without consulting your healthcare provider. If you're interested in other medications with side effects, click right here. Here's a list of common side effects, and this list is by no means exhaustive. Muscle pain is the most common side effect and reported about 2 to 13% of the time. Side effects are GI side effects, abdominal pain, nausea, diarrhea, constipation. Musculoskeletal side effects like muscle aches and pain, muscle tenderness, joint pain, headache, weakness and fatigue, memory problems, increased blood sugars. Here are 8 surprising facts with Rosuvastatin. Number 1, this medication in rare instances causes liver damage. Your healthcare provider will be checking your liver parameters. If you're feeling unusually tired, have dark urine, yellowing of your skin and the white of your eyes, abdominal pain, and a loss of appetite, these could all be signs of liver damage. Number 2, this medication can cause your blood sugars to increase slightly. This can be seen with some individuals. As a diabetic, make sure you're monitoring your blood glucose levels. Number 3, Crestor can interact with antacids such as Tums. Make sure when you're taking the antacid, you take it 2 hours before or after taking in Crestor to avoid this interaction. Number 4, the FDA does recommend a dosage reduction in Asian patients. This is because per data the FDA was looking at, Asians had higher plasma levels of this medication when compared to Caucasians. 5, when taking in a statin, especially at higher doses, or if you are an older adult, you are at a higher risk for muscle-related adverse events. Here are examples of 4 muscle injuries that can occur. Myalgia, characterized by muscle pain and aches without an elevated CK. CK or creatine kinase is an enzyme that is leaked out when there is muscle damage. Myopathy, muscle pain and aches with an elevated CK. Rhabdomyolysis, this is muscle damage coupled with acute renal failure with an elevated CK. And lastly, immune-mediated necrotizing myopathy, with an elevated CK and in the presence of these antibodies. Your healthcare provider can occasionally check this muscle enzyme in a simple blood test. If you want a more detailed breakdown of statin-induced muscle injury, check this video. Number 6, if you're on a blood thinner called warfarin, you would be at an increased risk for bleeding. Your healthcare provider will have to dose adjust your medication accordingly. Number 7, having a serious allergic reaction is rare. If you do feel shortness of breath, have chest pain, wheezing, hives, itching, swelling of your face, lips, or throat, call your doctor or go to the ER as soon as possible. Number 8, here are just a few medications which can interact with Crestor. This list is by no means exhaustive, and always talk to your doctor or always talk to your pharmacist if you're starting a new medication. And here are some other videos which you can click on. Thanks for supporting this channel. Have a good day and think your health. Don't mess up. Oh, I'm pretty happy with the way. Why are the birds screeching? Things went. Standing in my patio and a plane was flying over, so I did. Okay, it's done. I'm happy.